Thank you, Madam Chair, and thank you, members of the committee. I work at Rice University for the Hobby Center of the Study of Texas, work with Steve Murdock, former state demographer and former Census Bureau director. And I was asked to come and talk a little bit about the study we did on the impacts of the Affordable Care Act. And when we looked at this, we began this work actually before health care reforms passed. Actually then looked at all the things that impacted demographic groups in Texas. Now, we looked at the full impact of this Affordable Care Act for not only the state of Texas, but for counties in Texas. But I know that we're talking specifically about Medicaid expansion, so I'll talk a little bit about those numbers. On your second table, you'll see selected groups that we looked at being impacted by the Affordable Care Act. We actually had 3 different scenarios, but looking at the potential of the implementation of ACA, more likely to be the moderate scenario. And so with the moderate scenario, the Affordable Care Act will add a little over 700 children in the insurance pool, both covered by public and private insurance, those eligible for Medicaid and CHIP, about 1.4 million. There are 2.5 million eligible in 2010, estimated 1.2 million covered by public and private insurance in 2010. Estimated impacts of the adults eligible for Medicaid, about 935,000 under the moderate scenario. We've also included a couple of maps that looked at the impacts to your local counties, both what the current insurance looked like in 2010 and what it would likely occur under our moderate scenario for counties if all aspects of the Affordable Care Act were fully implemented. And if you looked at those counties, primarily those counties in urban areas and in rural areas will have the most impacts to that change. After full implementation, 37 counties will have rates of uninsurance higher than the state as a whole, compared to about 100 counties today. With that, I'll close my presentation.
Thank you very much. Questions? Thank you.
Thank you.